All right, yeah, so that gives me an idea of some of the areas that you're interested in. That's great. So we've got everybody here that can um, cover your questions. And if you're not sure which degree you're interested in, I can tell you more about them in today's session, and then maybe you'll have a better idea once we're done talking. So let's kind of get to it. As I said, I already mentioned how to raise your hand and use the chat box. So we'll skip that slide and that slide and get right into sharing a little bit of information about our program. So the Medical and Health Professions Education Program was developed because there is a need, of course, for health professionals. And with that, there's a need for health professions educators. And so, you know, I'm sure many of you have taken classes from people who are experts in their field, but they're not necessarily experts in the learning sciences and teaching and learning. So what our programs do is help experts in the health professions to learn more about best practices in designing learning experiences and assessing learning experiences and how to work with differing student populations. So the students who come into our program are from, it's just a great mix of interprofessional students. So we have MDs, we have PAs, we have administrators that work in health professions education. So we have, you know, just a wide range of students that come into the program. And when they graduate from the program, they go on to become health professions educators, they can become faculty, they can become administrators, they can work at academic health centers, research universities, and community colleges. So that's what's really cool about the program is it really is an interprofessional group of students, as well as if you were to look at the bios of all of the people that are here from the program, we all are very much an interprofessional group of educators. So to touch on the mission of our program, we really focus on that diverse interprofessional learning community. And our goal is to teach our students, to teach their students, to advance diversity and inclusion and equity in the health professions. Because not only are we teaching a very diverse group of students, but our students go on to work with a very diverse population in the health professions. Our program is fully online. It is fully asynchronous. We do have some synchronous sessions like this on Collaborate, but it's really designed to be asynchronous so that you can work full-time in your job while also being in the program. So it provides a lot of flexibility. Also, by being so fully online, we've really helped and really helped our students through the COVID crisis. So if any of you are teachers now, you know the challenges of taking your classes from face-to-face to online. And our students who are currently in the program said being in the program, the coursework and the experience of being a student in an online program helped them to translate their courses from face-to-face to online during the whole COVID crisis. So as I mentioned, we have several different pathways to get your education in health professions education. So we have 4 different graduate certificates, we have a master's degree program, and we have a doctoral degree program that has 3 different concentrations. So the certificates we offer is we have the certificate in simulation program management, and that is directed by Bob Armstrong, who runs our simulation center here at EVMS. We also have certificates in leadership, we have certificates in teaching, and we have certificates in scholarship or research. And all our certificates can be completed in just about 1 year. We also have a master's program, as well as a doctoral program. And the doctoral program has the 3 concentrations: higher education, contemporary human anatomy education, and the ultrasound and imaging education program. And the curricula for the master's and the doctoral program really have 3 kind of focuses to them. So they have a teaching and learning focus, a research and scholarship focus, and then the concentration focus. And the students who are in the master's program follow the higher education concentration focus. So the teaching and learning is really focused on teaching our students how to design and assess educational experiences by thinking about the diverse learners that they'll be teaching, and by thinking about all of the sociocultural contexts that impact learning. So we have the teaching core courses, and we also have a practicum where you actually design an online course, and I'll provide a little more detail about that in a minute. In the research core, you can see we have quite a few courses, and depending on which degree program you're in, you would take a different number of courses. So the master's students only take 2 courses in this. They take the educational scholarship methods and the program evaluation, where the doctoral students will take all of these research courses. And then finally, the 3 concentrations for the doctoral program. The higher education concentration focuses on teaching students about the administration of higher education, the structure of higher education, and also the focus on what today's higher education or college and graduate students really look like. The contemporary human anatomy education and the ultrasound and imaging education concentrations really help the students to learn how to design and assess and manage programs in anatomy or programs in ultrasound and imaging. So the goal with those students is that they would go on to become directors of ultrasound and imaging programs or human anatomy programs. As I said, we have a virtual practicum. So the practicum is fully online. You don't have to come to campus for anything. And in that practicum, as students, you are designing a course from beginning to end. So from designing the learning outcomes and the syllabus to coming up with methods for assessing the student learning. And we've targeted this practicum so that you would actually be designing a program or a course that you can use as a professional in your professional work. And this practicum is for master's students, doctoral students, and the students who are in the teaching certificate. So for the master's and the doctoral students, there also are a few culminating experiences. Master's students have the virtual practicum, but they also complete a portfolio and capstone course. And then the doctoral students, on top of the practicum and the portfolio, also take a candidacy exam and complete a research dissertation. This slide just provides an overview of some of the details of the program length. So the doctoral program, our goal is for your students to complete the program in 3.5 to 4 years. So it's pretty accelerated. It's 48 credits. Master's students, the program is 31 credits and takes 2 years, and the certificates, as I said, can range from 7 credit hours to 12 credit hours. And I've got the admissions requirements and some application deadlines on here, and all of this information can be found on the website as well. So I'm not going to go into too much detail about it here. And then finally, I just wanted to share a little bit of information about EBMS. As many of you know, EBMS is a small medical health profession school. So we have the medical school, but also a school of health professions. We're affiliated with Centera Hospital, but we're also such a small organization that it's a very collegial place to work. Everybody is working toward that common goal with a focus on impacting lives of people in our immediate community. So even though this is a distance program, we're hoping that you are impacting the lives of those in your community. So we have a focus on service to the community. And we are part of the distance learning group of programs within EVMS, and we're supported by what I will say is a great instructional design and technologies team. They are it's a small team, but I've worked at larger institutions, and they, I think, would shine and would stand out at any large institution that I've been to. So it's really great to know that as an online student, that you have a really good support team in place. Sorry. So that is really all. That's my whole song and dance. I would like to allow you guys to ask questions. I see that we already have a question here about transfer credit, so I can talk about that. But also, if you have questions, feel free to raise your hand. I want to learn more about why you're interested in the program, and answer the things that you really want to know more about today. So Daniel, I'll answer your question real quick. We do allow transfer credits into the PhD program. The maximum number of hours is 12 credit hours. And of course, would have to see the transcripts, the transcript as well as the syllabi from each of the courses, so that we have an idea of how those would transfer into the program. So that would have to be a discussion that we would have, but we do allow those transfer credits. And as you can see, now that we have the camera up and the slides down, you can see Dr. Torino, Dr. Gonzalez. So please, if you have questions, feel free to raise your hand or jump right in. Don't be shy. Or if you are shy, type your question into the chat box. All right, Jennifer, you had a question? So you can turn on your microphone there at the bottom.
I do. Good morning, all. Thanks so much for this great presentation. I was curious to know a little bit more about the process of the dissertation and how that works. And if we are working for a university, is there a way to collaborate with faculty at EVMS as well as our current institution?
Yeah, that's a great question. So the dissertation, again, you would start that after you complete your coursework. And we do have 2 tracks in the doctoral program. We have an EDD and a PhD. If you're doing a PhD, you would do original research. And if you are doing an EDD, you would do a program evaluation. And we do, because we have students all over the country and could potentially be all over the world, we definitely allow students to collaborate with the institution that they're at. So we currently have a student who's at Tulane who is going to be doing her dissertation based on the courses that she's teaching there. So what we would do is, with your dissertation committee, you would have to have a chair from EVMS, and at least 2 members of your committee need to be from EVMS, and then you could have one outside member from your institution. Does that answer your question?
Yes, thank you so much. I really appreciate it.
Mm-hmm. Does anybody else, any more questions? Let's see. Oh, PhD versus EDD, yeah. So there really is not a difference in the curricula for the PhD and the EDD. So all students take the same courses, but it's really in how you approach the courses. So students who are interested in the EDD generally are interested in going into more of a leadership administrative role. So they would look at the coursework from that perspective. So for example, in the EDD, you would be in the higher education concentration. That's only available in the higher education concentration. But when you take the organization and management of higher education, or the current issues in higher education, or the diversity in higher education courses, you would, all your assignments, you would gear your kind of lens through that administrator's role versus through a faculty member's role. So that's really the difference there. And I can tell you at EBMS, we have plenty of people working here that have both PhD, either PhDs or EDD. It's definitely a mix. So, that's a great question. Other questions?
Where have graduates gone on to from here? What roles are they playing in higher education?
Can you repeat that? The first part of the question was kind of blobbed out.
My sound may be off. What roles do graduates that you've had, what roles do they now have in higher education across the nation?
Okay. Well, so we have not graduated any of our doctoral students yet. So our first cohort is just getting into their dissertation process in the spring. But I can tell you what roles our students who are in the doctoral program are currently in, and I can talk a little bit about where our master's students have gone. So the doctoral students, as I said, we have a mix. We have, like in the cohort that's graduating, or that we hope graduates in the next year, we have one person who's an educator in teaching anatomy courses. We have one person who is a pathology assistant who also teaches anatomy. And we have another student who is focused on artificial intelligence and simulation, and he's working with right now the Department of Defense. So it's kind of a broad range in that group. So because most of our students are currently working, they are looking to continue in their job or to move up in their job. So in our newest cohort, we have a student who's an MD who's been running the graduate medical education in her institution, and her institution actually asked her to get this degree because they needed help with to really understanding how to design a curriculum. And then once COVID hit, they pushed her to get into this because of the online component. Our master's students, much the same. We've had a lot of students who, after their residency, do the master's so that they can have, both that clinical side and that teaching side. So it's really a mix, and kind of people go into different careers. We've had, in our master's program, we also have had several people who work in simulation. And so that gives them a master's degree as they're working in the simulation world. Lisa, you had a question? I guess your hand's down. All right, does anybody else have a question?
Oh, can you hear me?
Yes, we can.
I guess. Oh, okay, I'm sorry. No, I was interested in the certificate program for in the spring. It was a practice management conflict resolution, and I wanted to know some information about that program since it was about a 4-week course.
I am not sure I'm not sure what certificate that program is. We don't have anything, we don't have a 4-week conflict management course. Our concentrations are in simulation. It was what?
I'm sorry, it was under public health, under the public.
Oh, in the public health program?
To health.
All right, your sound's kind of fading in and out, but the public health program, that is a different program. We can definitely, provide you with some contact, or actually, let me see if I can find the link for you to, or Amanda, can you look and find the link for her for the public health
I just posted it to the chat.
There you go. She just did it. She's so far ahead of me. All right. Thank you.
Okay. Thank you. I couldn't figure which link to look on for the sessions because this had medical certificates under it, and this would link me to you. So thank you.
Okay, that makes sense. Great. Well, glad we could steer you in the right direction. All right, do we have other questions? Danielle?
Yes, good morning. How's everyone doing? My question is that I'm an occupational therapy assistant, and I've been doing it for like over 12 years. And I want to teach, but I'm not sure how this degree would be beneficial to me, if that makes sense.
Yeah, so are you talking about that master's degree then?
Yes, ma'am.
Yeah. So how it would benefit you if you, when you have time to look at the website, you can look at some of the coursework. And so the courses in the master's program really take you through, how to design a course. So it's really about how to understand your learners, how to design, how to teach. We also include some of that scholarship and research in there. And then the higher education classes help you understand the students that you're teaching. So especially, say, if you were to teach at a community college or university, understanding who those students are, what their backgrounds are, and understanding kind of how that impacts their learning is really important. So it would take, the experience that you have in occupational therapy and combine that with that understanding of teaching and learning practices.
Okay, thank you.
So do you have like an idea of where you would want to teach?
No, but I know I want to teach.
Okay. Yeah, so it's just, most people start teaching and they sort of base their teaching on their experiences with good teachers or bad teachers. So you do what the good teachers do and you don't do what we thought the bad teachers did. But this gives you a little more framework and foundation for why the good teachers were good and why the bad teachers were bad. So it helps you in that way. Yeah.
I mean, if I had to choose, it probably will be early childhood development or somewhere along pediatrics.
Okay. Yeah, and our program isn't focused on any specific population. It's really about you understanding teaching and learning in higher education.
Okay.
Are you saying you want to teach in early childhood education, or you want to teach about early childhood education?
Teach about early childhood education.
Yeah. So, so then that's kind of a whole other area that you would want to consider, and that might be that you look at a college of education as well and see what kind of programs they have. When you're looking at programs, and this is kind of the advisor in me, not selling this program in particular, but when you're looking at programs, look at the content, look at the courses, look at the instructors and what they do research on, and that's going to help you figure out which one is really going to fit your goals.
Okay, thank you.
Mm-hmm.
Dr. Giesing, Daniel had a question in the chat about how many doctoral students are in the cohort and an acceptance rate.
Okay. So, well, we have, like I said, we're just in our third cohort of doctoral students. We have 3 that are going to be finishing up this year, hopefully, or the next year and a half. But that are finishing their coursework this spring. But then we have 13 in the current cohort that just started in the fall. So I know that's a broad range. And the acceptance rate, oh, geez, I really should know this off the top of my head, but I don't. Let me try and think. I'm trying to do math right now. We were at about I would say 50 to 60% acceptance rate. And it really is, as we're looking at the applicants, we're looking at not just, like, we're looking at, do you have the needed components? So, the things that we say in the admissions requirements, do the candidates have that, but also how do they fit within the cohort? So, as I said, we have a really, really diverse cohort, diverse in career backgrounds, diverse in, just socioeconomic and other backgrounds also, and diverse in just their career goals. And that really makes for a great learning community. So we take all of those things into consideration when we're looking at the cohort. And because we have, as you can see, we have so many concentration directors, those are the advisors. So even though we have 13 doctoral students, which is a lot for a doctoral program, they're split up among the 4 concentrations, or the 3 concentrations, but 4 directors. So everybody has a lot of one-on-one help. All right, and Simon, I see your question here. So Simon, are you interested in the doctoral program then? Or you already have a doctoral degree?
And Simon, you're welcome to turn on your microphone in the bottom center of the screen if you'd like, or continue to use the chat if that's where you're comfortable.
Okay. So you're interested in the doctoral degree. So, so yes, this is definitely a fit because the program is a combination of core content focused on teaching and on research. Students do a dissertation, a research dissertation for the PhD, or do a program evaluation for the EDD. And if physical therapy would be a great fit.
And if I may jump in here, one of our current students in the contemporary human anatomy concentration is also a PT who's working on his PhD to also advance his skills in teaching.
All right, cool. And because we have all these other concentration directors on here, does anybody have any questions about the concentration? Or Richard, do you want to take a minute and talk a little bit about the contemporary human anatomy concentration?
Sure, I can do that. So good morning, everybody. So for the contemporary human anatomy concentration, this is not a degree that is going to teach you anatomy. At this stage, we already expect you to know anatomy, to have had some dissection experience, to have had some perhaps even classroom experience involved in anatomy in one form or another. The reason why we call it contemporary human anatomy is because anatomy has experienced a lot of actually tremendous paradigm shifts over the last 10, 20, even 30 years or so. Classically trained anatomists, as some of us have come to know them, those are becoming extinct very, very fast. And part of that reason, it's because of the very nature of how education is done, not just at the medical school level, but in allied health level professions as well. There's much more of an expectation of, for example, integration of content rather than have the siloed topics that you do in one semester versus one semester and things like that. You're expected to know pedagogically how to combine all of these different areas of study and merge them in a way that, one, can help students become competent in that information, and second, be able to take this information and translate it clinically. And some of these people will then go one step further and go to the ultimate level as combining the comprehension, the translation, and then being able to pass it on to the next generation. So this is not about learning anatomy, but it's application of anatomy. The contemporary trends is, how do you take this information and integrate it? And I take a perspective of looking at looking at 5 basic pillars of anatomy: structure, function, development, variation, and at the end of the day, is clinical application. That clinical application is how you take all of this and teach it. Teach it to a student who want to become a PT, MD, or whatever, but also teach it to your patients, because at the end of the day, it's also important for patients to become empowered. And there's nothing better than empowerment than knowledge, and be able to understand and have a communication with your clinician. And of course, there's exposure to different technologies, and how do you utilize all of these different technologies in terms, at the end of the day, integration, developing unique teaching strategies that match your personality, your interests, and the trends in which the field is going. So I'll stop at that. I can go on and on at this, but anyone who's interested, I'll be happy to communicate further with you over email or over the phone.
Thanks, Richard. And Felicia, can you talk a little bit about the ultrasound and imaging education concentration?
Hi. Well, similar to Richard's comments about anatomy, it isn't about teaching you ultrasound at all, but we find as ultrasound is maturing as a profession, there is a definite lack of educators. And so the hope of this program is that we can help learners, professionals to explore some techniques that are based on good sound, pedagogical theory, to teach concepts that are specifically changing very quickly and that fit into some of the changing paradigm of ultrasound as it moves more towards point of care. And part of the aspect of that is the physics, the instrumentation of it. How are you as an educator going to keep up with the many changes that the technology has allowed? And then how do you fit them into a changing and maturing curriculum and keep up with what your particular learners need? Because every institution will need a specific focus to meet their need. And also, I would say, if you have any questions or need any other information, you please feel free to email me, and I would be happy to go over that with you too. Back to you, Peggy.
Yes, and we can put our email addresses in the chat function so that you have our email address and can reach out to us. And Amanda, did you want to talk a little bit about the higher education concentration?
Sure. The higher education concentration is complementary to the other 2 tracks, because unless those are specific things that you're interested in, we can kind of capture a wider variety. Yes, pedagogy is changing, but what's unique about the higher education concentration is that students in this concentration often have a foot on both sides of the camp. They are wanting to be a faculty member or are currently a faculty member in some form or fashion, and maybe they're also a leader of some sort in their department or want to be one. They might be a director or an assistant dean. Maybe they want to advance in the administrative ranks. And so we in the higher education concentration, take a kind of a broader look at higher education in general and how academic health centers fit into that context. Looking a lot at leadership, organization, and management, issues like diversity, equity, and inclusion, and current issues in higher education, because we have to stay current with the times, especially in our job.
Hey, Richard, are you answering the question about the, thank you. All right, we also have one of our students, Brielle Ashley. She is currently just started this fall, and she has offered to share a little information and insight from a student point of view. So we'll let her step in here.
Hi guys. Some of you may have already seen me in the earlier session, but I wanted to pop in and just join some of my hopefully future classmates and give you some insight into what it's like to be a current student who is also a working mom of 3 and clearly working a full-time job. And I know for me that was one of the hardest hurdles to overcome. Can I really do it? But I'm here to tell you that you absolutely can. It does require some juggling a little bit of what your time management can compensate for, but all of the faculty are extremely understanding and supportive, and they are willing to work with you. I think the other thing that was really concerning for me was, can I really find a topic that I love so much to spend 3 years on? And I have been advised by 2 of the individuals here in the session today, and Dr. Burbage and Dr. Giesing, and they have been really helpful in helping me focus what it is that I truly want to spend my time on, where the pathway of my dissertation might take me. And although what I thought I'd start out with is not where I'm at even today, even early on in my dissertation experience, I am certainly not an expert in the dissertation yet, but I will get there with the help of these faculty members that you're staring at on your screen today. But I do want to tell you that it is possible. If you're still on the fence, I'm telling you, you just need to take the leap. You can absolutely do it. These experts and faculty are here behind you 1,000% of the way. And I saw that there were some chat questions. I don't know if they were any of them specifically for me. Let me go back through them. Does anybody have any questions about what it's like to be a student? Or any of your concerns that maybe I can help you with? All right, well, I'm going to stick around, so if you change your mind and you have some student-specific questions, I'll be in the chat to help answer those for you as well. Thanks for giving me an opportunity to speak, guys.
Yeah, and Daniel asked how many classes at one time. So for the master's program, you're taking 2 classes per term, so 2 3-credit-hour classes. In the doctoral program, you are taking 7 credit hours, either 6 or 7 credit hours each term. It kind of depends. So there's a couple terms where you're taking 2 3-credit-hour classes plus a 1 credit-hour class. And that 1 credit-hour class is focused on kind of getting you to start thinking about and working on your dissertation topic. So like what Bree was saying, you know, we start you kind of thinking through that topic in the process in your very first term, so that by the time you get to your final term, you're really ready to roll with your dissertation proposal. Last night, Richard and I got to go through 2 proposals with 2 of our students. They did presentations of their sort of early stage dissertation proposals, and they are well on their way. They're looking great. So they should hopefully sail through the next 1.5 years of getting their dissertation done. You guys have great questions. Any other questions that we can answer? All right, so we have lots of information on our website. If you haven't already been there, the full curricula is up there. We did just update our mission and our program goals and student learning outcomes, so I recommend you take a look at those. We've all shared our contact information in the chat, but our contact information is also available on the website, and the website is, I will take that in, /MHPE. Or that. So if you have any questions, please feel free to reach out to us. We are always here to respond and to help you through the process and to help you through the application process. Oh, that reminds me. So for those of you who are interested in applying for the program, there are details of the admissions process on the webpage. So feel free to reach out to us about that, or if you have questions now, we still have time if you want to answer those. All right, so I think that's it. We'll stay on.
Sorry, Peggy, is there a deadline for the application?
Oh, I see that. The deadline for the doctoral program application is May 1st, and the master's is June or July 1st. The 2 J months are messing me up. And even with both programs, we have the deadline, and then it's kind of rolling admissions after that. So we encourage you to try and hit that deadline, because we start making decisions and then we keep accepting until the class is full. So you guys are really on the right track by joining this session now and starting to think about it now. Any other questions? All right, well, we'll stay on here for a couple more minutes. If anybody else has any questions that they want to ask us, otherwise, that's really all the information I have. We recorded this session. I'm not sure really how they're going to be made available, or Amanda, if you can answer that. But
yeah, I can answer that. The recording of this session will be available on the virtual open house lobby in a few days. And folks who registered will also get a link to the recording in their email.
Great. Awesome. All right. Well, great. Thanks to all of you. And again, we'll just hang out here for a couple minutes if you have any other questions.